Okay, what does nursing in the US look like and what's the pay? Let's start from what does it look like. In bedside aspect, you get lesser patients compared to like the UK where I used to work. So most times you get 1 to 5 patients during the night and 1 to 4 during the day. Depending on the states, depending on the hospitals, most times it's like that. However, when you are short, they can give you 1 more extra. When you are short, most times you would just get your 4 during the day and your 5 at night. Some hospitals might be different, but I tell you, most hospitals, that is the patient to nurse ratio. So in that way, it might be less stressful because in the UK, I used to have more patients. However, I also think here you delegate duties a lot. Like you get the EKG technicians coming to take your EKGs. Some hospitals, nurses are expected to do that. But if you work in all those big hospitals, you get an EKG technician. Respiratory therapists will come and nebulize your patient. Wound care nurse will come and do dressing most of the times. However, there are some dressings they will tell you to do, but most times they come for their round and they do dressings for everybody. But sometimes they tell you to do some, they answer off some. So all those things will kind of take the stress off you as a nurse. You're expected to face your nursing work. Unlike some other countries I've worked, sometimes you're even expected to bath patients, change bed sheets, and do all those kind of things. Yeah, the CNAs do all those things, but you are expected, if they need help and you are less busy, you can help them. Yes, you should be helping each other. It's a teamwork, but at least most times you concentrate more on your nursing work. And so that kind of thing, I would say, is a little more less stressful compared to the other one, to the other country I spoke about. However, also, I think you have more critical thinking skills you have to use here because you are the center of everything. Doctors are calling you for this. This is calling you. Are expected to do so many things, work with case management, work with PTOT, answer so many questions about your patient. Like you are the center of attraction as a nurse here. So if there's a critical lab, you are the one that should interpret that to the doctors, like call the doctors about it. So I think you have more responsibility. Your brain has to be working. You have to so many things. Like you are in control, and they expect that of you to do highly of yourself and make use of your nursing skills and critical thinking skills. So in that aspect, I think much is expected of a US nurse. However, apart from being a bedside, most of people here are nurse practitioners. Everybody's reading. I like that vibe. Even now, I'm beginning to feel that I'm left behind. So everybody's trying to read, trying to be doctors of nursing practice. That kind of vibe is here. So that is how nursing in the US look like. It's kind of like you are trying and you're striving. You're not just like, I want to be myself and then. Although some people are like that, but most people want to ask for more. Pay is good, depending on the years of experience, depending on the state. There are some states that their pay is very terrible. So most states will pay more according to your years of experience. Unlike the UK, band 5 is band 5, band 6 is band 6, no matter the years of experience. Yeah, they consider your years of experience, the kind of hospitals you work, so pay and your bargaining power. So you can be 20 in the same unit and your pay is very different. They also pay us every 2 weeks, so which is good. Before you finish spending one, another one has come. That one thing is very long ago. You will have finished spending it and you'll be thinking, hey, when will 1 month come? But every 2 weeks, some weeks in a month, you even have 5 weeks. So that means you get paid 1 week extra. Sometimes it happens like that. So the pay is good depending on whatever. So compared to it, the pay is better, although cost of living there might be higher, but however, it's still more. You still save better, you still save more, and there's still money. Okay, and you can take a lot of extra, especially if you are not a travel nurse or you work as a float nurse or internal agencies. Oh my God, you earn so well. So, anything. Take care. Bye. I hope I've been able to answer your question.